So it seems like if you look in any of the ergonomics literature or go to offices, there are places to rest almost every single body part. There are wrist rests, there are elbow rests, there are neck rests, there are rests and rests and rests. But you can actually get injured from resting certain body parts. Here to explain that phenomena is Dr. Robert Markison, our chief medical expert. Thank you, Dr. Markison, for coming on. And let's talk about resting.
Yeah, we're in a world of a lot of props and a lot of supports, and we're bipedal, free-handed, moving animals, moving species. And so it's kind of anathema to think that, oh, I've got the perfect chair because it's got 5, 6, 10, 20 levels of back support, as opposed to a chair that permits more the swing of it and the natural movement of the body without undue support, so that you at a core level are already comfortable and mobile. The idea of resting is the worry about physical compression. And so if you rest your elbow, you can compress your ulnar nerve, and the consequence is numbness and tingling, outer half of ring and little finger, and worse yet, the deeper portions of that nerve are called motor axons, motor nerve portion. And so you can get weakness in 15 out of 20 small muscles in the hand. And the ulnar innervated muscles can give you 20 to 40% of grip and pinch strength. The biggest, most powerful muscle in the hand, originating from third and second metacarpals inserting on the thumb, is the power of pinch, which is ulnar innervated. So you can lose pinch, pickup, sensibility, dexterity, resting here, or resting on the ulnar side of your wrist, where the ulnar nerve is about to enter the ulnar tunnel, also called Guyon's canal. And so resting here, bad idea, bad for ulnar nerve. Resting, wrist rest, can affect ulnar, but perhaps more importantly, can affect the median nerve, the carpal tunnel nerve, notorious for getting carpal tunnel syndrome, but not only carpal tunnel, because I'd say 80 or 90% of my patients who ultrasonographically, electrodiagnostically, clinically, and historically have carpal tunnel syndrome also have tightness of 2 to 3, sometimes 4 centimeters of distal superficial forearm antebrachial fascia, fiber tissue. So they're wearing a tight cuff in addition to a tight roof of carpal tunnel. So then they're resting on a wrist rest, compounding the problem. So here you go. You've got compression here, aggravating pre-existing or previously silent carpal tunnel. Then things go from bad to worse. Static rest, wrist rest. Bad idea for median nerve, and to a lesser extent, ulnar nerve. And so all of these props, including splinting yourself, which is a problem because you splint and make certain, the key joint of the hand is obviously the wrist. Because in Greek, we have tenodesis, pull of tendons. So I go like that, and the tendons are pulled over the top of the wrist and hand. Desis, pull, teno, tendon. That's natural. I go like this, and they fold into the hand. As soon as you splint, you remove the tenodesis effect. So now you're straining members that otherwise would be partially activated simply by wrist positioning. Wrist is the key joint of the hand. So you never want to do that. And then wearing these elbow straps for tennis elbow, they're blocking inflow arterial oxygen nutrient cell delivery, and they're blocking waste washout through the veins and lymphatics. So they've got, in an ecological analogy, a stagnant inflammatory waste dump because they put a constricting band, quote, tennis elbow strap around their bad idea.
You know, there's one other thing that you told me about a long time ago, Dr. Markison. It's the fact that not only are you resting on that ulnar nerve when you're resting on an armrest, but it's the elbow is bent, which means that that poor nerve has to stretch around. And I think it's more exposed because of that bend.
Yeah, it's more exposed. About 25% of humans have a natural tendency towards jumping over the funny bone, medial epicondyle. And so you're not only stretched tight if you're in continuous flexion, but you can pull it forward a little bit, and more trouble can arise. So I'm ever aware clinically and ultrasonographically of the behavior of nerve, swelling of nerve, the way the nerve looks as I'm using high resolution ultrasonography in the office always to see what the nerve configuration is. And you can ask, why would a nerve swell if compressed? And the answer is you have about 30 millimeters mercury pressure head of arterial inflow supply. Outflow supply at 5 millimeters outflow pressure is being blocked, more in than out, swelling. And the configuration of the nerve is continuously changing from maybe a nice, happy circle down to a tight, squashed ellipse. And it really varies with position. And certainly if you add the insult of external pressure, things go from bad to worse.
Yes, I think we really need to emphasize the fact that we're not supposed to be slouching and resting and leaning on furniture and hard objects and hard edges and expecting ourselves to work from there. And we certainly shouldn't be unnecessarily immobilizing ourselves. And there's some funny names. I remember hearing about Saturday night palsy, of the drunken person who slumped against the chair back and does a number on his nerves because of that. So it can get colorful.
Well, that's exactly right. And then when I was at San Francisco General Hospital through the decade of the 1980s, running hand surgery, we had many homeless people who were sleeping on hard surfaces, and they'd come in with compressive neuropathies. You'd surgically decompress them, but depending on the duration of symptoms, they might not do well because you have about 12 to 18 months before the neuromuscular junction motor end plate dies away. So no matter how you decompress it, there's no transmission between nerve and muscle. And so having seen the worst of the worst and completely unserved, underserved medical populations, I can tell you that we don't, in our little remote white collar so-called life, want to be thrashing away too hard, too percussively, and then have things pressing on vital structures like nerves.
I think everybody should be informed about the preciousness of the nerves and the soft tissues, and that should be part of our general education. And certainly anyone who's using some of these devices, which more and more, I mean, you sort of can't avoid them. So
Right.
This has really been valuable. Thank you so much for sharing your knowledge with us, Dr. Markuson. We really appreciate you.
Thank you. I wish I was teaching 5th or 6th grade health class. It would have a different curriculum.
Yes, I would love to be in that class. I would be in the first row.